The global impact of COVID-19. What is the situation in Iran? And what about Europe? Hello, I'm Anand Naidu, and this is The Heat. The number of COVID-19 cases worldwide continue to explode, and from the Middle East to Europe and the Americas, the death rate is climbing. About 50,000 people have lost their lives to coronavirus in Iran, and in Europe, countries like Italy that were hard hit early on are again battling a coronavirus surge. But there is some good news. This week, the United Kingdom became the first Western country to approve a vaccine. We will take a closer look at the situation in Europe in a few minutes, but we begin with Iran. Joining me now via Skype from Tehran is journalist Sarbas Nazari. Also with us here in Washington, D.C. is journalist and political analyst Negar Mortazavi. She is a columnist for The Independent newspaper and the host of a podcast on Iran. Thanks to both of you for joining us. Sarbas Nazari, let me start with you. Iran is one of the countries that were hardest hit by this pandemic. We have about 50,000 people who've died in the country so far, and a lockdown was recently introduced. What can you tell us about the situation there?
Well, what we are witnessing at the moment, according to Health Ministry statistics, is some relative respite in the mortality rate and a very slight drop in the infected cases. The deaths, which were hovering around 480, are now as low as 350, which marks about a 25% drop. The government is taking pride in the fact that the severe lockdowns are already paying off. For now, a large number of cities which were under a red alert have improved to what they call the yellow status, in which major reopenings could be introduced soon. And we are expecting some easing in those restrictions nationwide as of Saturday. In fact, the earlier warning that the mortalities may hit the 1,000 mark is no longer an imminent nightmare, at least for the time being. However, there are serious challenges still ahead. We know that health experts are predicting another powerful resurgence in winter, when the virus, according to them, is anticipated to rage with more potency. They believe that if the guard is lowered, the next peak will be even more deadly and costly. But all in all, the current relative relief is seen as a victory for health experts and doctors, as they managed to ultimately convince the government, which was adamantly resisting serious alarms for reasons which were mostly economic.
So, Sarbas, I'm guessing that most people in Iran are complying with these restrictions that the government is imposing.
Yeah, to a great extent. When we compare the Iranians to many other nations, for instance, across Europe, Iranians have been more compliant to health protocols and social distancing, despite all the other livelihood matters that they are coping with on a daily basis. Many, of course, are disillusioned and frustrated after nearly 10 months. We have seen some 5 million jobs already being lost, and that tells us how devastating the economic impact has been. We have also seen some blame game between the public and the government. Some officials continue to accuse some people of disregarding the measures, while ordinary Iranians, many of them believe that the government has had a very slow response.
Yeah.
At times it has been inconsistent, confusing, and sometimes chaotic, and that the government has been accused of prioritizing the economy over the public health. But in general, from my personal experience, visiting, moving across Tehran and visiting other cities, you could say that the Iranians have been to a great extent following all the protocols.
Negar Mortazavi, of course, the Iranian government is under all kinds of pressure. There's sanctions pressure, there are security threats, and now, of course, the pandemic. And I know you follow events in the country very closely. What do you make of the way in which the authorities there have responded to this crisis?
Well, I think there were different phases of the response to the crisis. At the very beginning, where actually other countries as well, we saw similar trends in Europe and even here in the US, there was confusion, and also it seems like attempts to more politicize this issue and cover up of the actual numbers and the extent of the pandemic and the acknowledgement and acceptance by the government. There's been a lot of criticism on the lack of transparency on the issue of numbers, which actually is very key for the public to understand the magnitude of a pandemic like this, and then Iran becoming the epicenter of this virus in the region. But I think over time, the government has been trying at least to catch up. Like you said, the Iranian government is under immense economic pressure from U.S. sanctions. There's also a lot of mismanagement of resources and high corruption inside the country that the government is dealing with. So all of that has put a pressure on the economy, which ties the hands of the state as far as lockdowns and closures and being able basically to tell people to not go to work, to stay at home, and still support them financially. So that has been a challenge. But at the same time, there are some good advances, I think. For example, something that's been a little unexpected for Iran is to come out strong for the government against religious ceremonies, for example, Friday prayers. These are areas that can become super spreaders. A lot of people gather together. It's very intimate and close spaces. There's been a lot of restrictions put on that, which by a religious government has been unexpected. So I think there have been some good advances. There's some virtual learning when it comes to schools in certain red zones, as the Iranian government is calling it. But at the same time, the epicenter or the more sensitive area still remains the capital, which is Tehran. High population, the largest city in the country, and a lot of traffic back and forth, which is something the authorities have been trying to control, the city of Tehran.
Sarbas, what can you tell us about the Iranian healthcare system? Is it able to cope? Are there enough doctors? What about things like hospital beds, especially intensive care units?
Well, the health minister had warned before the lockdown that the new lockdown is the last opportunity to save the medical infrastructure, or it will soon collapse because the virus has been, according to him, 10 times more aggressive than it used to be. We know that the medical infrastructure is massively understaffed, fatigued, and worn out at the moment. But generally, well, Iran has always been an advanced country in terms of its medical experts, the committed medical community. But let's not forget the fact that the magnitude of the crisis has been immense in Iran. Hundreds of doctors have died in the front line. Thousands of nurses have been infected so far. And there are too many other implications with the crisis for hospital staff, including psychological aspects of the depression, being away from family members for weeks. And there was this report a month ago saying that many of those nurses need serious therapy after the crisis, that they're already facing multiple traumatic experiences. But generally speaking, the medical infrastructure compared to the early days of the pandemic, the onset of the pandemic, is rising, and it is trying to cope with the situation, and the situation is now at the moment relatively improving.
Negar, of course, there are all kinds of opinions in Iran on why the numbers are so high. Here's what we heard from one shopkeeper. Let's listen.
The main reason is that people don't observe the protocols. Youth are taking this issue too lightly. People have become careless, and they don't imagine that they can be infected, and they say it's not possible to be infected with coronavirus. They don't realize it until they get infected. Those are the main reasons.
So what are you hearing, Negar? I mean, is this a problem among young people, the fact that they're not observing these protocols, things like wearing masks, practicing social distancing?
I think to some extent, but again, it's very difficult to just blame this either on the population or on the government or a certain demographic. And because the entire world is dealing with this issue, and we hear a lot of similar reports here in the US, I'm living here, you hear all kinds of complaints of certain demographics or certain areas not taking this virus seriously. So to some extent, I see that also happening in Iran, but at the same time, I see a lot of public health messages being put out there, and in some ways, the population itself warning themselves, warning others. And I think what's most important right now with this virus after a few months is the issue of experience. I hear a lot of talk among ordinary people, telling each other if they have a young member of family who's been infected, or in severe conditions, warning each other that this is something that you should be more careful about. But I think it also has to do with the mixed messaging of public health officials around the world. We've had that here in the US. The World Health Organization, at the beginning, there was a lot of emphasis on washing hands, and then there was emphasis on wearing masks. So there has been mixed messaging on that too, and naturally in Iran, the population has been trying to catch up on how serious this virus is, indoor, outdoors, different age groups. So to some extent, I would say the population is following the messaging, but of course not in all areas.
Sarbas, we've heard a lot about the impact that sanctions is having on Iran and its ability to fight COVID-19. How badly are sanctions hurting that effort?
Well, this has been a pressing issue from the very early stages of the pandemic. First Iran was facing a crisis about its testing mechanism. There was a huge lack of testing kits. After some time, the problem was resolved through imports from friendly countries. But then we had the problem of ventilators. Next was the issue of international banking sanctions for imports of medical equipment, and even trivial equipment like liquids and gloves and all the basic stuff that the medical community was suffering a shortage from inside of the hospitals. So the problem is still pressing at the moment, because the government is facing huge banking restrictions, which blocks the entry of imported material.
Right.
And the other big issue in this regard is about the government was promising to distribute influenza vaccines to somehow prevent the impact of the coronavirus and kind of cope with the situation. The influenza vaccine promise has not yet been fulfilled at the moment, because the explanation by the government is that the severe international banking restrictions have blocked those imports, and there are millions who still were supposed to be vaccinated, but at the moment it is still an unfulfilled issue.
Okay, we have to leave it there. Sarbas Nazari, Negar Mortazavi, thanks to both of you for joining us. We turn now to Europe, where countries like Italy are still being slammed by the disease. And while the United Kingdom is also struggling, it is the first Western country to approve a vaccine. Joining me now via Skype from Naples in Italy is Gloria Taliani. She is a member of the Italian COVID-19 task force, and she is the director of the Clinic of Infectious Diseases, Policlinico Umberto. Also joining us from Cambridge in the United Kingdom is Chris Smith. He is a clinical lecturer in virology at the University of Cambridge. Welcome to both of you. Chris Smith, let me start with you, and let's start with that big news on vaccines. Britain has become the first Western country to approve a COVID-19 vaccine. Here's the British Prime Minister Boris Johnson.
I know that the whole House will want to join me in welcoming the fantastic news that the MHRA has formally authorised the Pfizer vaccine for COVID-19. The vaccine will begin to be made available across the UK from next week.
So that's good news in the United Kingdom, Chris. Question is, what's the plan for the rollout, and how widely available will this vaccine be made?
Yeah, indeed. Boris Johnson described this as biological jiu-jitsu. But therein lies the devil is in the detail, as they say, because what we've got to do now is to distribute millions of doses of something that needs to be kept for a reasonable period of time at -70 to -80 degrees C. And that's an issue. Now, many hospitals do have -70 or -80 degrees C freezers, but care homes don't, and nor do general practices and primary care settings. And the vaccines are in batches of about 990-ish doses. And what that means is that you can't, as one of our deputy chief medical officers said, treat this like a yogurt and just get it out of the fridge and put it back in again. You have to thaw the whole batch and then use the whole batch. So this is a logistical nightmare. And they're now trying to work out an efficient way to do this.
So given all those challenges, Chris, how soon can we expect the British people to be vaccinated in relatively large numbers?
Well, there's a pecking order that's been drawn up by our JCVI, that's the Joint Committee on Vaccination and Immunisation. They're an independent body who have made various assessments, and they have come up with a wish list of people who they think should be at the top of that list for the vaccine. At the top of the list are people in care homes. They're the individuals who are the oldest individuals, the frailest in society, who've borne the brunt of the mortalities so far. They're also joined by the people who care for them and healthcare workers in general. And so what the government are going to do is, in the first instance, use hospitals as hubs, and they're going to start the vaccination rollout probably as early as next week in healthcare settings using those 50 hospital hubs, and then start to scale out from there. And at the same time, we know that there are other front runners in this vaccine race that will be joining the ranks of the approved pretty soon, and hopefully they will come along in the near future and they'll be available, and they don't have this same temperature constraint. So soon we could be actually vaccinating people with more than one vaccine product.
Gloria, let's talk about Italy. Of course, the country was hit very hard when the pandemic first hit the world. That was months ago. But now the country is reporting more COVID fatalities than any other European nation. Why are numbers rising again so quickly?
Well, there is a large variability in the percentage of deaths all over the world. There are some countries that report percentages as high as 9%, which is a very high range of mortality. At present, there is no explanation for these results, and Italy ranks a significant 3.5%, 4% of mortality, which is really higher than other countries in Europe and all over the world. But really, it's not easy to explain this variability in terms of efficiency of the systems, because we have to admit that Italy has created a quite efficient health system for assistance, for treatment, and for assistance of the patients. Therefore, the reason is probably to be searched in other areas of the COVID-19.
Chris, we also have a similar situation in Britain. It has the highest coronavirus toll in Europe, and it's just come out of a month-long lockdown. Why are cases so high in the UK?
Well, the cases are high in the UK because we started from a high point before the second lockdown situation. The reason is the same as in many countries, actually, just more acute in the UK, and that is that in creating surge capacity, in other words, we emptied hospitals to create lots of free spaces, we sent lots of people back to care homes, and those care homes residents had coronavirus, and they then triggered outbreaks in those care homes. There was also a problem with getting enough personal protective equipment to the staff in those care homes, training of staff to handle infectious outbreaks in care home settings. So unsurprisingly, the mortality rate in care and residential homes among elderly people were very, very high. Elsewhere across the social demography, it wasn't quite so bad. And so it does appear that the mistake that the UK, but many other countries made, was to take their eye off the care home ball. And if we had our time again, I think probably that would have been the intervention that would have really made a difference, and we would be looking at a very different outcome under those circumstances.
Chris, in the UK, are people generally complying with the restrictions that the government is imposing?
Yes, they are. Broadly across the board, most people are supportive. Most people understand the benefits, the reasons why these things and these measures have to be in place. It doesn't mean, though, that they're happy about it, and many people are expressing considerable disenchantment. We anticipate that will improve, though, because we're back out of a lockdown. We're back into the tier system that the government imposed, which is a way of looking at the country which is regionally sensitive. So rather than just saying the entire country is closed for business, actually you can be more strategic. If you've got areas which are showing high levels of activity and disease circulation, then in those particular areas you can escalate the intervention or de-escalate the intervention corresponding to how much disease activity there is. And that makes people a bit more comfortable because it means that you can actually aim at a target. Let's get the numbers down in our area. We'll come out of tier 3 and be in tier 2, for example. So it kind of incentivizes the public. And also there's Christmas to look forward to. The government have put in place various measures to enable people to celebrate Christmas, albeit in a limited way, which I think also is helping to ease the disenchantment, plus the shot in the arm to the nation's morale that knowing there's a vaccine coming now and it's a real deal, it's going to be going into people, people's lives are going to change. That's really also helping to lift the nation's mood.
Right, literally a shot in the arm. Gloria, I was looking at some of the measures that have been taken in Italy. I understand there'll be restrictions on travel and even a ban en masse on religious gatherings. And that, of course, during the very busy Christmas period. Ski resorts in the country will also be closed. So I guess people won't be going on winter vacations this year. How are Italians coping?
Well, I think Italians cope quite well with the restrictions. We've been induced to rely on the decisions of the government, and we cope and we comply with them because we have noticed since the first lockdown, we were the first to open and to close the country and to create the first lockdown. We noticed that it works, and therefore we are prone to accept the restrictions that the lockdown implies. And of course, there is a number of people who disagree, but it's democracy, and therefore no one is surprised. But we have accepted, and we are going to accept willingly the restrictions, and even if they introduce a new landscape in the way we usually spend the Christmas holidays, nevertheless, we have the hope that it will be useful for the country, for the people, and will help to reduce the number of new cases, which is decreasing, steadily decreasing in the last 2 weeks after a certain number of restrictions have been induced in specific areas where the spreading of the virus was higher, and it was tailored according to the epidemiology of the virus in each single region of the country. And so I think there will be not much of problems.
Chris, on the question of vaccines, and as you pointed out a moment ago, there are several vaccines that will be coming to market. What can we expect? There's a lot of confusion. A lot of people think once the vaccination program starts, that we'll return to, well, I guess what's a normal life very quickly. Is that what's going to happen?
Well, if you think about the practicalities of it, the answer to that is no. One of our recent press briefings that the Prime Minister has been giving, they invited the director of the Oxford Vaccine Institute, Andrew Pollard, to present because he's involved in the development of the AstraZeneca and Oxford University vaccine, and asked a very similar question. His response was, well, you can think of this as a bit like climbing Everest, and many people are thinking, now we have a vaccine, we're at the peak. We're not. Actually, he put it that we're at base camp. And in fact, the bigger nightmare now is actually getting the vaccine that has been relatively easy to make into millions of people. And it's not just the question of vaccinating people, it's making the vaccines at the scale we need them, distributing them at the scale they have to be distributed, and then injecting them into people. Now, the best estimates at the moment, based on how they plan to do this, estimate that maybe 1 million people a week can be vaccinated. They might be able to push it further than that, but that's the current cautious starting estimate. There are 65 million people in the UK, maybe 68 million. Now, if we remove the school children from that estimation, because no one under the age of 18 is going to get the vaccine because they haven't been included in trials, therefore they can't actually have the vaccine, we're still talking at 1 million a week vaccination rate of probably a year to get through the whole country. So this is not something that's going to be solved immediately. And remember that everyone's got to be vaccinated with the present offerings twice. And so therefore, this is going to go on for a while. And until everyone, or at least an appreciable number of people have had the vaccine, we can't de-escalate any of these measures. So we have to get used to this normal that we don't like for at least a bit longer before we can kiss goodbye to this handshake and hug-free, socially distanced existence that we all loathe.
So does that mean, Chris, that even with 1 million people a week, that the rate of infection would slow down?
We anticipate that it would, but it's not so much the rate of infection that we're really worried about. What we're really worried about, remember, is the rate at which people die. And if there are people dying of this, that's always bad news. And what we're seeking to do with the vaccine is to stop the mortality. And so the immediate intervention in people who are at the riskiest end of the spectrum, and that's what they're going to do. They're going to go, first of all, for the oldest people, the frailest people, the people who are most likely to succumb to this virus if they catch it. They're going to be the first target for the vaccine. And that means immediately we'll see an interruption of the mortality rate, and from then we can move further down the demographic sort of pecking order and interrupt the transmission chain as we go through and more vaccines are available in greater volumes.
Gloria, what is the vaccine outlook in Italy? What kind of preparations is the government there making?
Well, we have been told that probably we will have the vaccine in the early weeks of next year, which is a good news. But as Chris said, of course, there are a lot of problems. Organizing a vaccination campaign is not an easy task to reach. Therefore, we are concerned about delivery and transportation and delivery and administration of the vaccines to the population with the same restrictions as in England, because data are similar in every country, and with an almost similar number of population of the similar extent of population. Therefore, it's a very difficult task to achieve, but it's feasible. And in addition, we have an Italian vaccine which is going to be delivered in the early 2021, which has a very nice perspective, because it's given in one shot, and therefore it probably make it easier to perform the vaccination campaign in the country.
Chris, very quickly, I've got less than a minute. How critical are the next few weeks going to be? Because, you know, we have COVID fatigue. It's also holiday season. People will be traveling. They'll be mixing with others. And, of course, add to that, it's flu season as well.
It's winter time, and we're sailing into the headwind of winter, as one of our politicians put it recently. So very, very difficult, because health services are already seasonally under pressure. And we've got all of the mixing that's going to go on across the Christmas period, which is going to translate into more cases. So this is going to become both a political and a medical headache in the new year, not just a hangover after Christmas and New Year to look after. We're going to have more problems medically, but we're buoyed up by the fact that we do see the end in sight now, and we've actually got a scientific triumph on our hands with a vaccine that's going to start going into people, and that's an amazing thing.
Well, that is indeed good news, and that's where we have to leave it. Thanks to both of you for being with us. And that is it for this edition of The Heat. Thanks for joining us.